Well, Pakistan has many problems. The gap between the rich and poor is widening. And then there is a huge constituency of people out there who really have no social protection, no fallback, and they're really being pushed to the limits of poverty. My name is Sania Nishtar, and I work in the area of policy advocacy in health, and I try to improve health systems in Pakistan and try to make them more equitable, and I advocate for that particular purpose. There are 120 million people in Pakistan without coverage for health, and out of them, more than 40 million run the risk of spending catastrophically on healthcare. So if they were faced with a major healthcare cost, it would definitely push them into poverty. It all started when I was publishing my last book, which is called Choked Pipes. It's about inefficiency of the health system in my country. So as I was finishing my book, I thought about a project which would help protect people against medical impoverishment. If people were running the risk of spending catastrophically on health, they could apply. The technology would make it efficient for me to process their requests. The pervasiveness of mobile phone use in the country would make it expedient for them to make the requests through mobile phone. Patients won't have to line up to request for assistance. They won't have to visit offices. Their files won't get lost in piles of paper. We have made request processing fully automated. Our online interface with the National Database Registration Authority verifies poverty status in 15 minutes. Well, the major chunk of the resources required for me to start up this project involved commissioning the creation of the technology. And that's where the Rockefeller's grant was extremely helpful, because I couldn't have done that without that pot of funding support. They try to identify the need, they help you with your own independent thinking, rely on your assessment of the on-ground situation, are very efficient in deploying the grant once they've made up their mind.